Hello, everybody. My name is Thorsten Lambertus. I'm the site lead at CDL-Berlin, operated by ESMT Berlin, Germany's top-ranked business school. We are operating two streams. The first one you already learned about from our partners in crime, HEC Paris, for next-generation computing. So this is all about quantum computing, photonics, neuromorphics, and all the exciting technologies that are of strategic importance, not only to Germany, not only to France, to Europe and the world. And so we have a great partner in a minor city called Heilbronn, the Dieter Schwarz Foundation, but we can tell you that this city is becoming one of the global hubs in compute, and we were very pleased that we could this year operate our very first session in Heilbronn together with the local ecosystem, campus founders, the TUM Technical University of Munich, Heilbronn campus, and many others who are building this great compute ecosystem. The second stream we are operating is healthcare. And our this year's poster child stems from this healthcare stream. Born out of one of the international leading research organizations, the Max Delbrück Center, they are developing TCR T-cell therapies targeting solid tumors. So they have raised already 8.5 million as a seed round. They have won multiple awards. They have also, our mentors were very happy with their development over the course of the journey. And finally, the sponsor of our stream, Bayer, was convinced by them to select them for their Bayer CoLab incubator. So join me in welcoming on stage Jana Hachmann from Captain T-Cell.
Thank you so much, Thorsten. Yeah. So before I dive into what it is that we do at Captain T-Cell, I want to give you a little bit of a backstory, although Thorsten already introduced me pretty nicely. So everything started 15 years ago with a thesis project of my co-founder, Felix. And I'm going to fast forward 14 years now and jump over a bunch of academic development of our technology, growing the team, and of course, lots of non-dilutive funding, to last year when we decided it was finally time to spin out and raise our first round. And we're continuing to raise additional funding with some non-dilutive funding that we raised at the beginning of the year, a little over 7 million euros. And yeah, we're going to move into the Bayer CoLab next month. And of course, we participated in CDL, which has been an amazing experience, received wonderful feedback there for some very important questions. So what is it that we do? So we work with T cells, which might not come as a surprise given our name. And for the non-immunologists in the audience here, T cells are the most potent immune cells off the human body, and they are usually there to fight virus-infected cells and to help you get over infections. But you can reprogram these cells to contain a tumor-specific receptor, and in our case, it's a TCR, and these engineered T cells are then manufactured into the final product and administered to cancer patients, where they then find and kill the tumor cells. And this development of the TCRs was the core of our business, and over the last few years, we've added additional technologies to this that we like to call our toolbox to further enhance the tumor-fighting capacities of these cells to really generate powerful cancer-targeting weapons. And just how powerful they are, I want to show you with just one piece of data from our lead candidate here. So this is a model with an in vivo model with mice, and the mice are growing tumors. And these tumors are super aggressive and grow out very quickly, and the mice very quickly die. If, however, you treat them with our product, the tumors just melt away. And the mice are cured, and they stay tumor-free until the end of the experiment. And this works if you use 10 million cells, but it still works if you go down in the dosing, if you use 2 million cells, and even with 400,000 cells, which is really not a lot. And I'm focusing on this because we often get asked how we compare to our competitor Adaptimmune, who had their first TCR, or the ever first TCR T-cell therapy approved by the FDA last year. And this is some of their preclinical data. And if you see, they can also achieve complete responses, but they need 8 times more cells than us. And this might not seem significant at first glance, but the amount of cells you need has a couple of different implications here. One, if you need less cells, you can use an automated manufacturing system, and manufacturing really is a big bottleneck in cell therapies. And also, if you have higher efficacy, you can attack or target more harder to treat indications, because the Tecelra product that was recently approved works well for synovial sarcoma patients, but this is a very small patient group of just several hundred patients every year. And last but not least, we are going for a completely distinct patient population here than Adaptimmune. So, and what is that patient population? So we're targeting patients with tumors that carry the marker MAGE-A4. And this comes up in a wide range of different solid tumor indications, with ovarian cancer, bladder cancer, lung cancer, and many others. And overall, there are 12,000 patients every year who run out of options, and they die from these exact indications with this marker. And of course, we want to help these patients, but this being a company, we're also interested in revenue. And if we were to treat all of these patients, we're looking at some significant revenue here of over $8 billion every year. This may seem a little overambitious, but I want to point out that if we were to treat less than 15% of these, we're already looking at a blockbuster drug here. And I'm super excited that we're going to be taking this to the clinic. We have a collaboration with 9 German cancer centers. We have a clinical trial fully funded, and we're expecting the results of that trial in 2028. And not only are we expecting the results of that trial, we're also expecting our allogeneic off-the-shelf platform to be clinic ready. Unfortunately, I had no time to talk about that, but we have some super exciting results here for that as well. And currently, we are raising a €6 million round to supplement the non-dilutive funding that we recently raised. We have $4 million of that already committed. We have additional LOIs, and we would love for additional investors to join us. So please come and find me after in the startup zone or contact me via Slack. Thank you.